Parallels between cancer and infectious disease.
Once in a while, though, the DNA blueprint in a cell can get damaged. Sometimes the cause is a chemical or environmental carcinogen. You might even have a hereditary risk for cancer. Other times, we don't know the cause. Normal, healthy cells are highly regulated by your body and listen to signals for when to grow, divide, and die. Sometimes, the cell's blueprint is damaged in such a way that it stops listening to the body and ignores the body's signals. And so, this rogue cell keeps right on dividing and dividing, eventually forming a tumor. In some cases, the cancer stays put and is localized. In other cases, the cancer spreads or metastasizes. When they are metastatic,
Infectious versus cancer. Infectious diseases and cancer have multiple similarities. Both infectious organisms and cancer cells express many proteins that are recognizable by host T cells. One and both elicit T cell mediated inflammation. An essential aspect of T cell homeostasis is that the responses of these cells must eventually diminish to avoid toxicity from excessive T cell proliferation and cytokine release. Unfortunately, this can lead to a loss of appropriate T cell responses, especially in advanced cancer and chronic infections.
My name is Rachel Miller, and I am currently a transplant infectious disease clinician at Duke University. Within infectious diseases, I became interested in transplantation in particular because these are a very challenging group of patients to work with. They have very difficult pre- and post-transplant courses oftentimes that involve infectious diseases, and the ability to be able to make an impact on these patients with regard to their complex problems was very exciting for me. One of my favorite parts about meeting patients for the first time is just being able to establish a connection with them. I love communicating with patients. I like sitting down with them, getting to know them.
Responses. Scientists have identified many of the normal mechanisms in cancer and indolent infections that ordinarily limit T cell responses. These findings have led to the development of agents that can overcome the limiting mechanisms to unleash or amplify ongoing T cell responses under conditions of adaptive immune suppression. First stage. These agents are designated to alleviate or reverse such events as T cell exhaustions, brought about by inhibitor molecules. An increased number of mildly derived suppressor and T-regulatory cells decrease expression of HLA-DR by antigen presenting cells and shifts from M1 macrophage to M2 macrophage, which dampen the immune system by secreting anti-inflammatory cytokines such as interleukin 10. Similarities between cancer and virus. Binding of TLRs and NLREs leads to the activation of common signaling pathways that regulate immunity. DMs and PAMs mediate and amplify inflammation, which results in the release of similar pro-inflammatory and anti-inflammatory cytokines, increased levels of reactive oxygen and nitrogen species, tissue wasting, and increased apoptosis. The totality of this process has detrimental effects on host protective and anti-tumor immunity.
An ancient Egyptian script called the Edwin Smith Papyrus that wrote about breast cancer. In today's video we look at cancer, what it is, how it happens, and whether it can be cured. Cancer is a word given to a group of diseases involving abnormal cellular growth that can potentially spread and threaten other tissues. But before we look at what causes cancer, we must first understand what it means. Cancer is the antisocial behaviour of your own body's cells that typically happens when various genetic abnormalities accumulate in its DNA. Cells contain a gene specifically meant to prevent.
A revolution in immunotherapy is underway in oncology, and its turbulence is beginning to affect the experimental treatment of infectious diseases. Granulocyte microbe colony stimulator factor is in clinical trials involving patients with cancer and sepsis. Anti-PD-1 and anti-PD-L1 drugs have been effective in several clinical trials to treat melanoma, non-small cell lung cancer, and renal cell cancer, and they are being tested in the treatment of human immunodeficiency virus infection. Interleukin-7, one of the most promising and broadly active immunomodulators, was efficacious in early trials involving pediatric patients with sarcoma and was found to reverse gut pathology in patients with HIV infection or GC virus induced progressive multifocal leukoencephalopathy. Approaches. In considering new experimental approaches, a central challenge is how to boost host immunity without causing potential adverse effects associated with an overreactive immune system. Serious autoimmune disorders develop in some patients with cancer who have been treated with immune checkpoint inhibitors of PD-1 and cytotoxic T lymphocyte antigen 4. It is believed that such disorders result from the unleashing of ongoing or nascent autoimmune-like T cell responses.
We're going to take a look at infectious diseases, what they are, some terms used to describe them, and take a look at a few different types of infectious diseases. First of all, what is an infectious disease? An infectious disease is a disease caused by an infectious agent like viruses, bacteria, parasites, or fungi. Infectious diseases are a global problem and in the past used to be the leading cause of death. There were large epidemics of smallpox, TB, syphilis, cholera, and plague that caused millions of deaths around the world. The 1918 influenza pandemic alone was responsible for the death of around 40 million people globally. Thankfully, advances in nutrition, antibiotics, immunization, food safety, housing, and sanitation has led to a massive reduction in infectious diseases. However, even now, they're a problem.
Let's see the conclusion. The recently announced an unprecedented collaboration among four major pharmaceutical companies in developing combination immunotherapy drugs for cancer underscores the perceived importance of immunotherapy and the recognition that teamwork is critical to success. Rapid tests of the overall health of patient immune system will enable clinicians to guide immunotherapy and follow its efficacy. Nucleic acid-based detection of mechanisms of immunosuppression and of reactivate latent virus might identify candidates for immunotherapy and enable therapeutic monitoring. Coordination of clinical trials with sharing of data and patient samples will expedite drug development. A change in clinical outcomes in both cancer and infectious disease will occur more quickly if investigators in these specialties pull together.